Record number of patients are filling hospitals across North Carolina. With more people needing hospital care than any time in the pandemic, I wanted to find out how the Omicron variant is affecting patients. WakeMed is seeing more COVID patients than ever before.
The numbers of admissions that we have from COVID are much higher than they have been even with the Delta variant.
But Chief Medical Officer Dr. Charles Harr says he isn't seeing as many cases of severe illness.
The patients who are admitted are not as sick as they were. We don't have as many ICU patients as we did, but they're sick enough to require hospitalization.
According to WakeMed, about 70% of COVID patients in the hospital are not vaccinated, and about 84% of patients needing intensive care have not gotten their shots. Rex Hospital also says more patients who are seriously ill are not vaccinated.
77% of our ICU patients are unvaccinated, but then the general floor, about half of the people have gotten vaccines. They may not have gotten boosters, but they're at least not ICU sick. So there is a benefit to getting vaccinated.
Rex's chief medical officer, Dr. Linda Butler, says most patients with Omicron don't need to stay in the hospital as long as patients who had the Delta variant.
Hopefully we will be able to get people back home quicker, and that will free those beds up for the patients that are still yet to be admitted.
Because hospitals aren't seeing any signs of a slowdown when it comes to COVID patients needing care.
But that overall number of people who have the disease is much higher. And so even if you have a lesser percent of people who require inpatient care, it's still going to be a much larger overall number.
Friday, the state reported a record number of 4,381 COVID patients in hospitals across North Carolina. With hospitals and emergency rooms so full, UNC Hospital announced tonight it will no longer offer COVID tests for people without symptoms at hospital emergency rooms.